Hello, everyone. It's great to be here with you again today. It's been since last Wednesday that I was with you, so I miss you all and not being able to be present with you on Wednesday. That was my attempt to take a day off of response. And then we did not have the media briefing on Friday. There just wasn't enough content to support that need. And so I'm back here with you today. So I'm glad to be here. I will start, as I usually do, with case information. So you may have heard that on Friday we had a case that came in, a female in her mid-50s. We had another case come in, similarly a female in her mid-50s yesterday evening. So that brings our total case count up to 28, with 26 recovered. We continue to have 0 hospitalizations and 0 deaths in La Crosse County. We have had a total of 1,925 negative cases tested in our county. Wisconsin case totals today that just came out. We have a total of 6,081 individuals in the state who have tested positive for COVID-19. That is an increase from yesterday of 170. We have 61,311 people who have tested negative for COVID-19. That is an increase of 2,076. We have 1,415 individuals hospitalized, which is an increase of 18 from yesterday, and a percentage of 23%. So I'll just note here that in the past, we've been seeing this hospitalization rate at 28 or 29% at its highest. So we're glad to see that that is in the 23% range. And our death total in the state of Wisconsin today is up 9 from yesterday to a total of 281. We do continue to see the state of Wisconsin be at a ratio of positives to total cases tested is 9%. So of all of the test results or all of the tests completed in Wisconsin, 9% are positive. And we have a significantly lower percentage in La Crosse County here, under 2%. So I will give you some updates. In addition to the case totals, which I just remind you tells only part of the story, we continue to want to see testing increase in our county and our region. We know that our healthcare partners are working on that, and we have seen increased cases or testing happen in the region, though not significant increases in testing yet here in La Crosse County, but that is something we're all actively working towards. And something that we'll continue to keep you posted on. I think at the state level, we have seen an increase of testing. So the goal would be that we can increase the number of individuals who have symptoms of COVID-19, could get a test for it, and we could know for sure if they do have COVID-19 or not. We want to just announce that the governor's office just came out with executive order number 34. And that executive order goes into effect on Wednesday, the 29th at 8 a.m. And it does allow some businesses to reopen. So I want to talk briefly about that. So minimum basic operations, it's important to note that the reopening is not an entire reopening, but of minimum basic operations for customer curbside drop-off of goods or animals, thinking about places like dog groomers, for the purpose of having those goods or animals serviced, repaired, or cared for by the business. In addition, just noting here that customers are still not permitted inside the business. So those businesses will make arrangements to make sure that they're in compliance with that. Outdoor recreational rentals. So minimum basic operations may include rental of recreational equipment, which may include but not be limited to boats, kayaks, canoes, paddle boats, golf carts, snowmobiles, and ATVs. Customers must remain outside the business or facility, and the rented equipment must be cleaned after each use. And finally, car washes. So entirely automatic car washes and self-service car washes may be open for service. And again, those reopening pieces begin on Wednesday at 8 a.m. So at this time, I would like to share with you, I hear a lot from members of our community through social media, through the COVID-19 email address, other mechanisms, that it is hard to stay patient knowing that our case numbers here in La Crosse County remain low. And while we're grateful for that, it's hard to justify the need to continue with all of the things that we've talked about, to include the physical distancing and the staying home, not going out with the exception of essential travel, not hanging out with non-household members. So I think those things are really hard. And what I want you all to know is that we are working really diligently on a number of fronts to advocate for our county residents. And that includes things like communicating and partnering with others in our tri-state region. So Iowa, Minnesota, and counties along the border here in Wisconsin. We have a weekly health department connection meeting where we find out and talk to other health departments like Winona, and finding out what their health department knows and needs help with in regards to the outbreaks that are happening in Winona County. Like in Alamakee County, both of those counties have had significant outbreaks and their case numbers show that, and sadly have also had deaths. So we do routinely communicate with those areas to assure that we are all working together. Again, we believe that that is really important to support our residents here in La Crosse County, because we recognize that people live and work and cross borders, and this virus doesn't recognize geographic borders. I also want to let you know that we will and have and continue to be committed to transparency. We want to make sure that everything that we know about testing is something that we're sharing with you. So just know that while it can be challenging to be patient and waiting for testing to ramp up and waiting for plans to be developed that are really detailed and help us understand when we can reopen and how, we are working diligently on that front as well. So we have actually put together, we've done a lot of research and we've put together suggestions, including components of plans that we think will not only complement, but benefit and increase the level of detail in plans like the Badger Bounce Back framework. So we want to make sure we're raising up things that are important and helpful to the state so that they can make decisions that are informed by local counties, and that comes up through residents like you guys. So at this point, I just want to make it known to you that we encourage you to think about if you have ideas or suggestions that we can take to incorporate into what we're sharing with the state and with our legislators and with the governor's office. We have those lines of communication, and if you have ideas, we'd love to hear from you. I know that many of you already share those, but know that we listen to those voices from our communities, and we want them to be constructive and informative. So please raise those ideas up to us, and you can do that either by commenting on social media during this live briefing, or afterwards you can send us a private message on Facebook, or you can send us an email through our COVID-19 email address, covid19@lacrossecounty.org. So we'd be really grateful to hear from you. We want to raise up your voices and make this work for you all as best we can, because we all are trying to work together to make this balanced and beneficial as best we can for everyone. I want to take a moment to just talk about perspective. I got to hear over the weekend a gentleman who turned 103 in Pigeon Falls. So maybe you saw this on the news as well. Pigeon Falls isn't too far from where I live, and I thought it was really special that this gentleman was actually alive during 1918 with the large flu pandemic. And I think one of the things he said on the news that I watched last night was really helpful. He said, what has got him through his 103 years? He said, a good attitude and positive thinking. So I know we have our mental health resident expert here today, but before I let her talk about her ideas, I wanted to just share that, in this situation, we can really choose who we want to be. And I think in La Crosse County, we do really, really well with this. We see generally people who are trying to learn and who are trying to grow. We do still see some people who have fears and concerns, but we'd really like to encourage you to look for the learning and growth opportunities in this situation. We know how hard that is. It's hard for me. It's hard for my colleagues. It's hard for my family members and my neighbors. But I think if we are continuing to spread informed information as opposed to things that come from a place of fear or anger, or forwarding all messages that we see as opposed to really looking something up and trying to evaluate that information before we spread it. I think that will help us be better at thanking and appreciating others. We can be better at looking for ways to adapt to new changes. So knowing that this situation is unprecedented in so many ways, and it shakes up our balance and our foundation, and we can choose to adjust to that. We can't choose the lack of control necessarily, but we can choose to do our best to adjust to it. And I think that also is practicing patience as best we can. There are some days where patience is really hard for myself as well as I'm sure for all of you. But I think we can find some solace in relationships and connections with others in creative ways. And I know you guys are all working really hard to do that. So I just wanted to raise up that I think perspective is really important, especially in a time where we don't have all the information that we really want to have. And we continue to search for and seek out that information. It will come, but patience is hard, and we have to just continue to ask that of ourselves and each other, to be patient with each other, and remember that there are many people who are working really hard to make this best for all in our state and in our county. So with that, I'm going to turn it over to Sarah Johnson, mental health expert from the YMCA, and she's going to share some great tidbits with us today.
Thanks, Jen. I always appreciate hearing from you, and I think you're making some excellent points that fit really well with what I wanted to share with us all today. So for those of you who don't know me, I'm Sarah Johnson. I'm the mental health director for the La Crosse Area Family YMCA. And my background is both in prevention and health promotion and as a clinician. So I worked as a counselor. And so I'm here to try to sprinkle some information in your brains as we think about what our current reality is, which is pretty strange. And I think Jen is hitting the nail on the head with that. We're kind of at this point where it's hard to be patient. A lot of us have been sacrificing a lot of things and had a lot of disappointments. And so as this kind of drags on, it's hard. We start getting tired, we start getting cranky. And so I want to talk a little bit about the concept of resilience today. So as you know, we've talked before about mental health as how we think, how we feel, and how we act. And we all have mental health. The way we're thinking right now, the way we're feeling, the way we're acting, all of those pieces are really being influenced by our current situation and health crisis that we're living with on the planet right now, which means our mental health is being impacted. Now, I've shared before that for most of us, we'll come through this what's called post-traumatic growth, meaning coming out the other side of this with new skills, new understandings, a new perspective, and Jen was talking about perspective there, a new filter for looking at life, a sense of meaning and purpose. And that's what we call resilience. So our ability to not only make it through difficult times, but make it through on the other side, coming back stronger, that is what resilience is. Humans are really resilient. We've seen this for centuries. People have gotten through lots and lots of difficult things. And what we know is even for folks who come out of this with some lasting difficulties, people are resilient, and there's lots of things we can do to help people manage that on the other side of this. So in any case, our ability to be resilient is huge. And so I want to think about, all of us in our life have been through difficulties at some point, some of us more so than others. And our ability to get through those experiences, even if we have some lasting impacts, that is our resilience. So I'd just ask you to bring to mind, what's a difficult experience that you had that you came back stronger from? How did you come back stronger? What did you do to get through that? Who did you lean on? Who are the people that you asked for support? What skills did you use? My guess is some of the skills that Jen was talking about: perspective, patience, leaning on expertise, so finding good information, connections, gratitude. All of these things are things that can help us build resilience. Now, we can build resilience in ourselves by asking for help. That's a really important skill. We can also build resilience by leaning on others, like I said, by trying out new skills, what I like to call coping skills, just the things we do to try to manage our difficulties and our challenges. And one of the number one ways that we can build resilience is through healthy relationships. Consistent, positive relationships make a huge difference. In fact, research shows us that the existence of one positive, consistent adult relationship with a youth can buffer from tremendous amounts of stress. So we really want to be thinking about right now in this period of time, despite our impatience, despite our frustrations, how can we show up to be that person for somebody else? How can we be that steady, positive support for somebody else? Because not only does providing that support for someone else help that person build resilience, it helps us build resilience too, because we're making that connection, we're contributing, we're there being connected with somebody in a really, really significant way. So I'm just going to have you bring to mind somebody who in your life was a resilience builder for you. And I'm going to share the person who comes to mind is many people. I've been very fortunate that many people come to mind, but one of the first persons who popped into my mind right away was my kindergarten teacher, Mrs. Conley. Mrs. Conley showed up for me every day as a positive force. I always felt unconditionally loved by her. I knew that even if I was having a bad day and I was weepy, because I was a super weepy, sensitive kid, she would be there. She wouldn't judge me. She would help me kind of take that deep breath, get my feet underneath me again, and keep going. That was a resilience builder for me, and it was huge. So who are your resilience builders, and how did they help you? How might you use some of the same skills, some of the same strategies they used to help build resilience in someone else? So if you're wondering a little bit more about this resilience stuff that I'm talking about, or aren't sure necessarily how do I do this, or how do I help teach this to somebody else? How do I share this information? I've got good news for you. Last Wednesday, we kicked off a new series on our Facebook page. We'll also be on our website as well, but Wednesdays and Sundays at noon, we'll be posting Dinner Table Resilience, which is our new series of 2 to 3 minute videos, pretty short little videos that give you tips and topics, skills and strategies to use to build dinner table resilience. So resilience right around your dinner table with the folks that you love and care about. You can also use it on Zoom calls. You can also use it when you're walking down the street a safe distance from somebody else, or when you're talking across your fence to your neighbor at a safe distance. So you can feel free to share these tips and topics with anyone. And in fact, the more of us who are practicing these, the more resilient our community will be. I want to also give you an opportunity to think about if you're trying all of these things out and you're doing all of the things that are, are good for your self-care, and you're still finding it hard to manage your worry, or you're really finding that your appetite or your sleep or your daily life is really feeling kind of messed up and not where you want it to be. Or if you're simply just looking for other resources, there are lots of resources out there. I would direct you to call 211 if you're looking for support or resources in a crisis, or just generally for support. You can also contact the Disaster Distress Helpline. That is 1-800-985-5990. If you are somebody who prefers to text, there are a couple of texting options too. You can text Talk With Us to 66746, or you could text Talk to 741741. Steady heads, open hearts, be safe, be well.
Steady heads, open hearts. I love that. Such a good Monday when I get some Sarah Johnson. Hopefully you guys get the same. It's really helpful. She reminds me to breathe. Sometimes I forget. I think we forget sometimes, Sarah.
Yeah, I agree.
Yeah, so thank you, Sarah, for your guidance and wisdom. It's always so helpful to us.
Thank you.
Let's go ahead and take questions.
Hey there, Jen. This is Justin with WKBT. Earlier you brought up the expanded opportunities from Evers earlier and just kind of talking about some of these non-essential businesses kind of opening up in a very limited fashion. I guess, what does that mean for our community in terms of kind of some of these businesses being able to finally open up in a very limited capacity? Excuse me.
I think it is hope, actually. I think it's helpful to know that there is the importance of flexibility where we're trying to determine what can open and how can it open at what level. I think that level of flexibility based upon what information we have at any given time is important. And I'm glad to see that the state is recognizing that. They understand that this is going to be an ever-changing situation. I think that might be one of the hardest things for our businesses and our residents in counties around us even, is to recognize that we have to flex with how a virus wants to act. And we don't know everything yet about how this virus acts and who all is really infected in our communities. And we're working to get that data at a level that we all want it. And in the meantime, we have to try to make good, solid, balanced decisions with the evidence that we have available at any given time. So I think it is helpful to know that the state is looking to support at least some minimum basic operations. We need our businesses to be running, but we need it to be happening in a safe way. So I think this is helpful to know that there are some pieces that can open for, we don't necessarily like this term non-essential businesses because everyone has an essential business, but in the terminology that the state is using to identify those that are, in that category, that they can do some minimum basic operations, I think is really a helpful sign, because it is a balanced approach to show we can take small steps, perhaps, even in the midst of the safer at home order extension.
Jen, we do have a question on Facebook regarding testing. If you think in La Crosse County we're seeing more people coming in to get tested, is that increasing or do you see it decreasing in La Crosse?
Yeah, thank you. So the question is about more people coming in to get testing. What we can tell you, I don't know how many are seeking testing. I don't have that information, but we know that those who need testing are still not able to get it at the level that we want that to be. We know that our healthcare systems are working to ramp up testing, but remember that they cover a large region, and that doesn't just include La Crosse County. So they are working to increase capacity for testing, and we will see more and more of that testing happening. To what degree, time will tell.
Hey, Jen, Justin again. Earlier you talked about, I think one new case. I guess, was that from community spread, or was this person traveling? I guess, are you able to share any of those kind of details with that?
Yep, thanks, Justin, for that question. This recent case that came in yesterday evening is not from community spread. It is connected to a lab confirmed case. So I think it's important to note that, so individuals recognize as best we can with the case information that we have, the risk level, but do just remember that this virus is out there, and that there has been, even in close by proximity to La Crosse County, in Winona County and other counties across the nation, there have been individuals that don't show symptoms, or their symptoms are so mild that they don't recognize it right away. So just remember the importance of the physical distancing, that is being asked of you for a reason, because this virus is spread predominantly through the air from anything as simple as breathing, which is why we recommend the face coverings. My family loves me because I make them wear face coverings every time we're out. When we go to Quick Trip to get milk, or when we have to go somewhere, we routinely wear those. And that's for me to protect others. I hardly go out of my house anymore, but I think the point is to make sure that if for some reason I pick this up somehow, that I'm not spreading it to others. And I would hope that others would do the same for me, that they would wear a face covering to prevent, when they're doing their essential travel, to prevent if they would be an asymptomatic carrier of the virus. Nobody intends for that to happen, but then they are protecting others around them from spreading. So I think, just re-answering your question, this particular case is not from community spread.
Thank you for bringing that up. And, kind of a follow-up to that, I know, when we kind of look at our information, a lot of people don't, as you say, really show the symptoms and don't really suffer quite as bad as others. And I know that patients might be a little bit on the low end here after the last month or so, but these are really steps kind of being taken in place to protect those of us in our community that would have a severe reaction or really would be at a greater chance of ending up in the hospital, correct?
Yeah, Justin, thank you for that clarification. You're right. So the reason that we're doing all of these things is obviously to protect ourselves from becoming infected, as well as our loved ones and our families and friends and neighbors. But predominantly those individuals that, if they got COVID-19, would get very serious illness. Those that have, we still think those that are over 60, those that are immunosuppressed on medications or with conditions, health conditions that put them at risk of severe disease. If they were to get COVID-19, we want to avoid hospitalizations and deaths in our county residents. And the way that we do that is by working together and doing the social physical distancing aspects. And of course, the potential that it may spread on contact surfaces as well. Hence the strong recommendations to do hand washing and not touching face, all of those sorts of things.
We have a question on Facebook for Sarah. If you know if the mental health resources that you mentioned are available for residents outside of La Crosse County?
Absolutely. Yeah, great question. They're free and online, and spread them as far and as wide as you can. Our mindful minutes go up on Mondays at noon. Our dinner table resilience series is Wednesdays and Sundays at noon. And then Fridays, you'll see on our Facebook page, we have an event called the Steady Heads Open Hearts webinar. That's at noon, and that's an hour-long webinar each week on a different topic. I think this week I was just working on, I'm thinking it'll be on courage. So we've had past webinars on acceptance and hope and vulnerability. All of those are up on our website at laxymca.org. Please spread them far and wide.
Justin, again with WKBT. I kind of want to talk a little bit more about the patients aspect, and I know we've been talking about that a lot today, but do you feel as though our community especially has been dealing with this extremely well, thanks to all of the generous people in our community who are giving back and are kind of stepping up to the plate and being those helpers and being able to put their best foot forward?
Yeah, I do think, we have so many wonderful people in our community. I look at the food drive as an example, and all of the support, the poundage of food coming in, and the financial support, which is all being matched by an anonymous donor. I mean, what a level of gratitude I have for this community and the goodness that they put into it. It's just wonderful.
This is Caitlin from Wisdom. We had a question on our Facebook page asking when we can expect antibody testing in our area.
Ooh, good question. I am eager to answer this one, not because I know when we'll be able to expect it, but what I want the public to know about this is there are two kinds of tests, really. And the first kind is the type that our hospitals are doing, and that's the type that tells us if someone has COVID-19, they can detect the virus. The second kind is the antibody test, and that test, and I apologize, my 8-year-old is just deciding to do some pull-ups in the basement right next to me. So if you hear him doing pull-ups, that's what's happening. So the antibody tests are really about understanding if someone has had infection in the past. So it doesn't necessarily say that they have it now. So that's very confusing. And I also have been keeping an eye on this at a national level. And initially the FDA, the Food and Drug Administration, which authorizes these tests, there were a number of tests allowed that are not as reliable as we want them to be. And so I am not in a rush to see antibody tests become widely available. I think it is valuable if we have an at-home test option, something that allows us to do like a saliva sample, for example. But we're not there yet. And I think that when we get there, it needs to be reliable, because if we get there in mass quantities and what we're getting for information out of those tests is not reliable, that will either give us false negatives or false positives, and that's not helpful to our overall response.
Justin with WKBT again. This one is directed for you, Sarah. Earlier you brought up the post-traumatic growth and resilience, and how, you know, people can use that to their benefit, especially after this is all over. Can you maybe tell us, and I know it might be pretty obvious for a lot of people, but, you know, just kind of give us a few examples of what that might look like, especially once we do make it out of this experience, and having those skills might be able to benefit your life for the future.
Yeah, I love that question, actually, Justin. It's really strengths-based. I would say, you know, I'm going to go ahead and use myself as an example. So I lost my mom to cancer almost 10 years ago, and really couldn't imagine before that living without her. Like I for many years was just very, very anxious about the idea of losing my mom, to the point that I couldn't really tolerate the thought. And I started practicing what's called mindfulness about 15 years ago. And Jen kind of referenced that reminder to take a breath. That breath and intentional practice of slowing down can really help us be present in the face of difficulties, and can help us build resilience. And so, well, it was really difficult, one of the most difficult experiences of my life while my mom was dying, and then grieving her death after that. What I found was, because I was willing to be present and feel all the emotions that we feel when we grieve, which is really what we're doing as a community and as a globe right now, I had gifts that I couldn't even imagine coming out of that. Because when we really experience difficulties, it helps us look at our life and say, what do I really want my life to be about? How do I want to show up? How do I want to live? Who do I want to surround myself with? And what are the activities I want to do? And so, out of losing my mom, I clarified a lot of really important things for myself in terms of some relationships, in terms of the activities I do. I'm doing a lot more art and music now since her death. And that was really a gift from losing her, and having that clarity of really, what do I want my life to be about? So there's lots of ways that we can grow beyond a difficulty and a challenge like we're in now that we probably literally can't even imagine. So showing up for your life, whether it's difficult or not, and maybe especially when it's difficult, is a really, really helpful and important and healthy thing.
I'm not seeing any other questions for you, Jen or Sarah. So,
well, I will just sign off then by saying, out of this media briefing, I took the statement, spread positive messaging and mental health resources and not the virus. So I'll end with that. Thank you, everyone, and we'll see you on Wednesday.